In general, copperheads, the season for them is like April to September. It's just early October, so I'm sure we'll see some more bites too. So copperheads are, if you're gonna get bit by a snake, it's probably the best snake to get bit by. Most of the envenomations are not fatal, which is great. They usually only bit if they're provoked. I think most people who get bit are young men, and that's because I think they're messing with snakes. Copperhead bites are very rarely fatal, which is good news for us here in the Northeast. Generally, you'll see only the local symptoms. It's super rare that we see anything that affects the whole body. What's true of a lot of, I guess, copperhead bites is that people have symptoms for a really long time. So even though the bite isn't fatal, people will have a lot of pain and swelling in that extremity, and that can go on for a month or two. Some patients even require like physical therapy later on. So generally when patients come to the ER with a snake bite, we expect to see more local symptoms. They'll have like bruising and swelling at the area, sometimes some redness. Occasionally you can see like blood blisters. And then the really rare things, which are the things that we want to watch out for and why we ask patients to come to the ER after a snake bite, are like an anaphylaxis-like reaction, so a super serious allergic reaction, or any systemic symptoms, so like nausea, dizziness, lightheadedness, sometimes anxiety. Those are really unusual symptoms, but the things that we worry about. Don't try to catch the snake. Now, I think that seems obvious, but I cannot tell you the number of times I've had someone bring in a live snake, a dead snake, or a cut up snake to the ER. You don't need to bring the snake. Just wash the area with soap and water, take off anything constricting like rings or bracelets, and then elevate the limb above the level of the heart on your way to the ER. Even for minor bites, we'll usually watch you in the ER for at least 8 hours. And the reason for that is that we're monitoring for the progression of the swelling or the redness. So when you first come in, we start with a worksheet, and it has how far the redness is, how far the swelling has progressed, and then measurements around the circumference of either the arm or the leg, because that's where most bites end up. If the swelling progresses a lot, that's when we consider giving like an anti-venom, which is Crofab. So Crofab is very expensive. It's a couple $1,000s per vial, and for initial treatment, you need 4 to 6 vials. And if it gets worse, then you might need another 4 to 6 vials if you're having a really serious reaction, or another 2 vials. So we're talking in the tens of thousands of dollars for treatment of anti-venom. If you're just living your life, you're very unlikely to get bit by a snake. The places that they like to hang out, like crevices and rocks, in wood piles, those would be the times that I'd be like more careful about what you're doing. If you're going on hikes in areas that have a lot of copperheads, I'd probably just wear boots or long pants.